If you're a parent, chances are you've heard the terms ADD and ADHD thrown around. They're often used in the same breath, and it can get pretty confusing. What do they really mean? Is there even a difference? And what should you be looking for in your own kid? Well, we're going to clear all that up. So let's just get right to it. ADD versus ADHD. What is the actual difference here? It's a question so many people have, and you know what? The answer is probably a lot simpler than you think.
Okay, here's the big reveal. The single most important thing to know. ADD is just an old name. Seriously. Since way back in 1987, the official medical diagnosis has been Attention Deficit Hyperactivity Disorder, or ADHD. So while you still hear ADD, it's not actually a formal diagnosis anymore.
And this isn't some rare thing we're talking about. It's a condition that affects millions and millions of families. I mean, look at that number. Over 6 million kids in the U.S. have been diagnosed with ADHD. That's exactly why getting clear, accurate information is so important.
So to really understand why the name changed from ADD to ADHD, it helps to take a quick peek back in time. It really shows how much our understanding of this whole thing has grown over the years. Think of it like this. Before the 1980s, everybody just called it ADD. Simple enough. Then, for a little while, doctors started splitting hairs, saying there was ADD with hyperactivity and ADD without it. But by 1987, the experts realized, hey, hyperactivity is a super common part of this, so they brought it all together under one, more accurate name, ADHD.
Okay, so if it's an old term, why do we still hear it all the time? Well, it's basically become shorthand. A lot of people use AD when they're talking about a specific type of ADHD, the kind where a kid isn't bouncing off the walls, the kind that's more about inattention. We're going to dig into exactly what that means right now.
And that leads us perfectly into how ADHD is officially seen today. So forget AD versus ADHD. Now, doctors talk about 3 different ways the condition can show up, or 3 types. So a child's specific behaviors and struggles will point to one of these 3 types. And this is so important because it shows us that ADHD can look totally different from one person to the next. All right, for you as a parent, what does this actually look like day to day? What should you be on the lookout for? This next part is all about the practical, real-world symptoms for each type of ADHD.
First up, we have the predominantly inattentive presentation. Honestly, this is what people usually mean when they say ADD. The main struggle here isn't so much physical energy, but more of an internal battle with focus. It can look like making careless mistakes, having a really hard time staying organized, being forgetful, or just getting distracted by, well, anything.
Next is the predominantly hyperactive-impulsive type. This is probably the picture that pops into most people's heads when they hear ADHD. We're talking about constant motion, fidgeting, squirming, maybe getting up and running around when they're supposed to be sitting. It also includes impulsivity, like interrupting people, talking nonstop, and finding it almost impossible to wait their turn.
And finally, there's the combined presentation. And yeah, it's pretty much what it sounds like. A child with this type has enough symptoms from both the inattentive list and the hyperactive-impulsive list. And here's something really important to remember. A child's symptoms can change over time, so the way their ADHD presents might actually shift as they get older. Okay, so let's say some of this is starting to sound familiar. What's the next step? Now we're moving from just learning about it to actually doing something. Let's talk about how to get ready for a really productive chat with your child's doctor.
So, why is talking to a doctor so critical? Because a lot of different things can look like ADHD. A professional is the only one who can help figure out if it's something else, like a hearing problem, vision issues, or even a learning disability that's causing these behaviors. To make that doctor's visit as helpful as possible, a little prep work goes a long way. Start by jotting down the specific things you're seeing. Think about when it started. For a diagnosis, symptoms usually need to be around for at least 6 months. It's also a great idea to get feedback from teachers and think about your family history, because ADHD definitely tends to run in families.
I know that first appointment can feel a little nerve-wracking. So let's pull back the curtain and talk about what the diagnosis process actually looks like. Knowing what to expect can really help.
So a doctor will usually start with a physical exam and ask about what's been going on at home and at school. They'll also check for other conditions, because it's pretty common for kids with ADHD to also have things like anxiety or depression. The process might also include questionnaires for teachers and maybe even a referral to a specialist.
Going through all this, it's only natural to wonder what even causes ADHD.
Well, we don't have all the answers, but research points very strongly to genetics. Other things, like being born prematurely, can also play a role.
Now, this next part is super important for busting some common myths. Things like eating too much sugar, too much screen time, or a stressful home life do not cause ADHD. But, and this is a big but, for a child who already has ADHD, those things can sometimes make their symptoms worse. It's a really key distinction to make.
So, if you remember just one thing from all of this, what should it be? It's this. ADD is just the old school name for what we now call ADHD. And the most important part? It's a manageable condition.
So please, if you have concerns, don't put off talking to a doctor. Getting a diagnosis isn't about slapping a label on your kid. It's about getting an explanation. It helps you understand why certain things are happening, and it's the very first step toward finding the best ways to help your child succeed. Understanding what to look for is step one. The next step is deciding what to do with that knowledge. So we'll leave you with this final thought to ponder. Now that you know more, is it maybe time to start that conversation?